Today we are going to discuss about the advanced surgical modalities of bladder cancer. So how does the bladder cancer generally present? The bladder cancer presents as a tumor in the bladder, and there are two types of tumor. So these tumors can be invasive and non-invasive. Generally, both these type of tumors present with blood in urine or something we call as hematuria. So how do we diagnose the bladder cancer? Generally, ultrasound imaging, CT scan are used to diagnose the bladder cancer. So once you see tumor in the bladder cancer, then what we do? What we do is that we do something called a TURBT or transurethral resection of the bladder tumor. Basically, we are just scraping the bladder tumor to find out whether it's an invasive or a non-invasive bladder cancer. So the invasive bladder cancer and non-invasive bladder cancer are managed very differently. For invasive bladder cancers, we do like advanced or more aggressive treatment like bladder removal, radiotherapy, chemotherapy. These are the commonly used modalities of invasive bladder cancer. But a non-invasive bladder cancer generally does not spread to the other parts of the body. So they are treated with very minimal medications only. Sometimes TURBT or just the scraping will be enough for the treatment of the non-invasive cancer. But to prevent recurrence or reoccurrence, what we do is that we put some medicines in the bladder. These medicines are called mitomycin, BCG, or sometimes we put other chemotherapeutic medications inside the bladder. So what are the advanced surgical treatment for invasive bladder cancer? So generally what we do is that we remove the whole bladder and we divert the urine to some other place. So when we remove the whole bladder, what we utilize is the robotic surgery. So cystectomy or bladder removal generally used to be a very big surgery with quite a bit of blood loss. So nowadays, with the advent of the robotic surgery, the blood loss during the surgery is very less. And we do this surgery completely through the keyholes. So there are only 4 or 5 keyholes and a small incision to take out the bladder. So what are the advantages of robotic surgery? So robotic surgery is associated with less blood loss, earlier recovery for the bladder cancer patients, and earlier return to work, and their complications with this are very less. So once we remove the bladder, we have to divert the urine some other part of the body. So what we generally use is that we use either a neobladder, where an artificial bladder is constructed using about a 55 centimeter of the intestine, or we can use something called a stoma or a bag, where a small piece of intestine is taken and is brought out through a small opening in the abdomen. So the patient has to carry a bag. Generally for elderly patient, this is what we do. This is something called ileal conduit. This is what we do so that they just have a bag like a sticker on the abdomen, which can be very well concealed by wearing a shirt or a dhoti or even a pants. On the other hand, the neobladder or orthotopic neobladder, where we create a big bladder using a 55 centimeter of the intestine, is done commonly in young patients. This is a relatively more complex surgery than ileal conduit, but young patients tolerate very well, and the advantage of this is that they can maintain their normal body habitus. So there won't be any bag, and people who are like seeing it from outside does not recognize this as a post bladder removal patient. The neobladder is also very frequently done in our Aster Medcity, and so far we have done more than 100 such operations, the bladder removal and the ileal conduit, so robotic manner in Aster Medcity. Thank you.